Good morning, good evening, good night, doctors, nurses, and pharmacists. So, I'm Dr. Che, and today we will discuss some important reading tips. Good morning, good evening, good night, doctors, nurses, and pharmacists. I'm Dr. Che, and today we will discuss. Sorry.
Good morning, sir.
This. Good morning. I should not show this.
Good
This is
evening.
not. Let me just open. I have to record class for my YouTube channel. That is why. Okay. Good morning, good evening, good night, doctors, nurses, and pharmacists. I am Dr. Che, and today we will discuss some important reading tips, especially reading part A, because we have discussed reading part B and C in another class, and today we will discuss reading part A. So, if you are new on my channel, please subscribe and share with other people. Okay, anyone can just recap how we do reading part A. We have already discussed in one of our free classes. So anybody can just discuss quickly, please. Anyone just quickly, please give recap how you will attempt reading part A. Can anyone unmute and talk with me, please? No? Can anyone unmute and participate, please? Can you hear me? Anybody can hear me?
Yes, I can hear.
Yes, please
Okay.
try to participate actively. Otherwise, we cannot continue the class like this. So if you are silent, I am talking. So in this way, it's difficult to continue the class like this. Okay. Okay. So anyone can recap just quickly how we attempt reading part A. What are the strategies for reading part A? Just quickly. What do we do?
Yes, first of all, we do skim and scan at least for 2
Uh-huh.
minutes. Okay, then
1 to 2
we will
minutes. Yes.
go directly to the question number 8.
Okay.
We will underline the heading, subheadings if there are some numbers.
Uh-huh.
Okay, then we will start by question number 8. We will
Okay.
answer the short answer questions. Later on,
Yes.
fill in the blanks. Then we will be more familiar with all the text. Then we can do easily question number 1 to 7.
Okay. That is good. Excellent. So where we should start, that is a different strategy. So I will discuss in detail. So first of all, whenever you get a question paper for reading part A, just tell you, you will have only 15 minutes. You will have only 15 minutes to do the reading part A. And out
Yes.
of these 15 minutes, you have to read, you have to answer question, all of these things. And another thing is, if you have taken IELTS in which you get the reading paper and you get complete 20 minutes, 1 hour. So you will have 15 minutes separately. Okay. Anybody knows about this? So you will have separate 15 minutes. You will be given a answer sheet. You will be given a question sheet. Okay. Question paper. And you will be given 15 minutes to attempt this. So after you answer these 20 questions, and in 15 minutes, they will collect your answer sheet, okay, and question paper. After that, you will finish reading part A. Then they will collect your answer copies and your question paper. Then they will give you next, okay, part B and C for 45 minutes. Okay. That is why timing is important in reading part A. Okay. You will have only 15 minutes. Okay. What you need to do is you need to quickly skim and scan headings, subheadings. Okay. The main paragraphs, what is in the first line, first sentence of each paragraph. Okay. Any digits, any dates. Okay. Any capital letters, any of these things. So just quickly skim and scan in 1 to 2 minutes, and after that, after you skim and scan quickly, you need to see where you will start. So some students, they start from question number 7 or 8 or 6, whatever, in the second part, because here is fill in the blank. So once they start in the fill in the blank, so they become familiar with the text. Then for them it's easy to answer question number 1 to 5 or 1 to 7. And some of the students, they start from question number 1 and they end at question number 20. Okay. So it depends upon you which suits you better. Okay. You can try both of these methods and you can see what suits you better. Okay. Okay. So now let us see the text. So what this topic is about, this text is about what? Can you hear me? Just please, all of you keep participating in the class so that I know you can hear.
Hello, good evening, sir.
Good evening.
Topic
Okay.
is treating blood.
Okay. So the topic is blood transfusion. Okay.
Yes.
So the main topic is blood transfusion. Okay. Then you will see what is in each text A, B, C, and D. Okay. So what do you think is in text A?
Text here treating blood loss.
Yes. How we treat blood loss. Okay. So by only reading subheading, you cannot understand what is in each paragraph. Okay. But you don't have time to read each paragraph. You will see. So the main sentences, okay, blood loss may result from injury, major surgery, disease. Okay. So how blood loss is, okay, how
Yes.
it is, okay, done. Okay. If there's too much, what we do, so all of these things, you can just take an overview. Okay. Whole blood really given to the patient. So instead, so means here they are talking about which part of the blood we give. Okay. Whole blood is really given, so then you give components. Okay. So almost in this text they will talk about these things. There is in the bracket is clotting factor. For example, you may be given substances to help your blood clot. Okay. So means they're talking about each component instead of whole blood, each component is given. Okay. In the last paragraph, blood loss during surgery sometimes can be recovered, clean and returned to you as a transfusion. They are talking about auto transfusion. They are talking about auto transfusion. Auto transfusion is when you transfuse the same person's blood to himself or herself. Okay. Okay. Any questions so far?
No, sir.
Now in text B, you have different types of blood collection. The main ways in which blood is collected include, so these are main ways. You don't need to go into details of all of them. Okay. So whole blood, homologous collection, and other is apheresis collection. Okay. So these are two methods in which whole blood is collected. Okay. Then Other less ways in which it is collected is autologous collection and matched collection. You can just read a little bit. Whole blood is collected from donor, only some components. Before a scheduled operation or transfusion, a person donates blood specifically for their own use when the donor has been identified as the match for a specific patient. Okay, so you can just get an overview if you download these classification and these things. Then we have text C, that is about transfusion reactions. So this is a table. How you will quickly skim and scan this table? Can anybody tell me how you will quickly skim and scan this table?
First of all, we will see the headings. It is describing complications, sign and symptoms, treatment, and extraneous.
Yeah, okay. This is the type of complication that is there.
Right.
Yeah, type of complication. Then we have, you can just quickly see.
Yeah, febrile transfusion reaction. We will say what its sign and symptoms may be and what treatment we can give, and it is most common or rare.
Yeah, okay. So here is the complication: febrile transfusion, hemolytic, allergic, TRALI, transfusion related acute lung injury. So then is transfusion associated circulatory overload. Okay. Then you have symptoms. Okay, just you don't need to read them, all of them. Okay, so there are symptoms. Then we have treatment: supportive, stop the transfusion, symptomatic, antihistaminic. So give blood slowly. Okay, so these are the this is the treatment of this complication. Then we have extra information: most common, vast reaction, then are actually allergic, most common cause of death, often occurs in elderly. Okay, just quick skimming and scanning. How it would help you? This skimming and scanning, how it would help you? When you will start giving answers, okay, so it would help you to quickly reach on the exact text. Okay, text D is safety of donated blood. Say the process of blood donation and handling of donated blood is regulated by Health Canada's Therapeutic Product Director TPD. Okay, and then it enforces 5 layers of overlapping safeguards. This and that. This is implemented by this. Okay, then we have donor screening. To donate blood, you must answer a series of questions. So then we have referred donor lists. Then we have blood testing, quarantine, quality assurance. Okay, so here in text D, can you hear me?
Yes, sir. Yes, sir.
Okay, sorry, I had a little bit disturbance in my room, and now I'm a separate place. Okay. So in donor screening, you have deferred donor lists. Organizations that collect blood must keep list of people who are permanently prevented from giving blood. So number 2 is blood testing. Number 3 is quarantine. Then is quality assurance. Okay. So now in blood testing, after donation, every unit of blood is tested for certain disease. And quarantine, donated blood is kept isolated from other blood. Okay. And quality assurance, blood centers must keep careful record of every unit of donated blood. Okay. So these are the things. Now we will start giving answers. Okay. So now just guess in which text you can find the answer. Okay. In which text you can find the answer. Okay. So treatment of hemolytic transfusion reaction. In which text is possible to find
A.
this information? In A.
In which
Anybody
text
else?
we can
Please
find
write in the chat.
information on treatment of
No, sir,
hemolytic
C.
transmission?
C.
C.
In school.
C.
Where is possible?
C, sir.
Hemolytic
And D
transfusion
is not
reaction
possible.
in B.
C.
B is possible.
B. In B, no, in B they are talking about different types of blood collection.
Yes.
In C, they're talking about some type of complication. Then they talk about the treatment that we give here in the third column. Hemolytic transfusion reaction. You can see here hemolytic transfusion reaction.
We can see it
And
in
this is the
a
treatment.
part.
Yeah, and here is the treatment. You don't need to read in detail here now. Just try to compare your keywords, okay? So here your keywords match here. This is just overview in reading part A. You just in which text you can find the answer. You guys give overview, okay? Less frequent ways of blood collecting blood. Okay, in which text is possible to find the answer? Just quickly, please. It's not
B.
difficult.
B.
In B.
B.
It's
Yeah.
D.
How you know that?
D.
In D.
Yeah.
Okay.
Yes, in D.
Okay. D for delta.
Yes.
Okay. Can you see here? If you remember from skimming and scanning, yeah, where you can match your keywords.
Sir, B.
The abdominal lists, blood testing, quarantine. Then we have quality assurance. Sorry. Okay. Can you find something here? Match your keywords.
Frequency of
And less common, sir.
Can you find an answer in text B?
Common when which blood is collected in
different
clear.
type of blood collection. This frequent way of collecting.
Where is your answer?
In part B.
In text B, but in exactly where? You can match your
I
keywords.
think match collection is a specific patient with a rare or complex blood group.
No.
Uh,
Anyone else? Anyone else?
be positive that only some
Yeah,
blood.
Other less common way in
Is
collected
in the
in
just subheading. You don't need to go into detail. The main ways in which blood is collected.
Yes,
And main ways mean the common ways, and the less
Less
common means
common
less
and less
frequent
frequent.
ways. Yeah, less frequent ways. Okay, so these are less common. Just this is paraphrasing of the language. So all of these are types of blood collection, and then you have main ways, and then you have less common ways. Okay. Okay.
So what's the
Next
exact
question
answer?
is B, a text B.
In the text
No,
B,
you will
but
not. This is not fill in the blank. It's just in which text you can find the option. You can find the information. Yeah.
We just don't need to go in the subsequent sites.
No, you don't need to fill in the blank. You just need to
Okay.
think in which text it is possible. Go there, verify if the answer is there, it means this information is there, then just write text A, B, C, or D, okay? For example, less frequent, this is in text B, you will just write B here, okay? This is your answer, B. You don't need to fill in the blank, okay? Recycling of blood wasted of a patient. In which text is possible to find the answer?
D.
In a blood reactions.
Text B.
Anyone else wants to participate? In text D?
Yes, in text D.
Okay. So here is your question and this is your text C.
Uh,
Do you think the answer could be in safety of donated blood?
No, sir.
Yes.
no.
No, sir.
Recycling of blood waste. But no, I don't think so. It's coming a D. But
No.
And D is difficult because
yeah, D.
you're talking about recycling of blood wasted of a patient. Okay.
I think it's the part of blood reaction.
And
Part
C?
C.
No.
Part C.
Text C. Can you find answer here?
No.
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 Up.
Can you find answer here in B? Please mute.
In the C.
Yeah, where is it possible to find the answer?
C.
And C?
Yes, sir.
I don't know why people keep, unmuting if they are in a place where there is noise.
Can we say A? Can we see A?
Okay, let us try. But can you see the answer in B or not?
No.
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 No. Okay, then let us go
No.
above. Let me copy your question here. Just write in the chat if you get the answer. Just write got it. Okay. Just try quickly, please, because in reading part A, you
Blood
will have
loss
only
during
15 minutes. Only 15 minutes to
blood
answer
loss during
20
surgery
questions.
sometimes can be recovered.
Blood
Please
loss
just write in
during
the chat. Write in
surgery
the chat. Please write in the chat if you
means
find the answer. Write.
waste blood of the patient.
I think all of you need to work on listening also, because what I'm saying, you're not listening. Write in the chat. If you find the answer, write in the chat. Then I will ask you to participate. Okay. Okay, Miss or Dr. Nirmala, can you hear me?
Yes, but I'm a
Yeah.
nurse, not doctor.
Where is your answer? In which paragraph?
Yes, yes, sir.
Text is A, but exactly in which paragraph? We have 3 paragraphs in text A.
Yeah, second paragraph, may need to
Second paragraph.
replacement of some blood substance if your body does not make enough of them. So I suggest
Where? In which line? Or in which line?
second, third, last third line.
This one?
Yeah.
Sometimes you may need replacement of some blood substances if your body does not make enough of them. For example, you may be given a substance to help your blood clot if you do not have enough of them naturally. There is no mention that recycling of blood wasted of a patient.
Replacement and recycling, I think same.
No.
Okay.
Sir, it is
So,
actually in the
it's a
part 3.
Replacement is just if you have something, a blood substance, so you replace it. It means you got new. Okay, or you can say a replacement is just when you take something from you. Okay, I give you something new as replace.
Yeah, okay.
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 Yeah.
um,
If you remember, we have a blood exchange in neonates or in other patients also. So when there is hemolytic reaction, you collect blood of that baby. Okay, you waste it and then you transfuse new blood.
Oh,
Okay,
sir, I got it. Last
replace blood.
line, blood loss during surgery sometimes can be recovered clean or returned to you as a
People is
transfusion.
thus recycling. If you don't know what is recycling, then you cannot answer the question. Just believe me. If your English is not good, if you don't know the basic things, what is recycling?
Clean and
You
return.
have waste at your
you have
time, in your home. Okay, waste just like plastic bottles, like and other things. Waste. Okay, then we collect that waste. This goes to the industries. Okay, where they recycle, they use it for other things. Okay, they make other things. This is recycling. Okay, so patient one when there is bleeding from a patient, blood loss during surgery sometimes can be recovered. You can recover it, you can clean it, you can return to the same patient as a transfusion. This greatly reduces the amount of blood you might otherwise need to receive. So this reduces the amount of blood you will receive. Okay, means you will receive your own blood, so it will be you would need less blood from other people. Okay, another thing is receiving blood back from the same patient is safer because there is no chance of a reaction. Okay. Next question is, which vital signs need to be checked before donating blood? In which text is possible to find the answer? In which text?
which word is I need to check?
D.
In which text is possible to find the answer? D?
Save it.
Okay, here is your text D.
in text D, which is your temperature, your blood pressure, and the volume of
Please
blood.
just write in the chat you got the answer, because other people need to think, need to find the answer. We need to give them chance also. Please. When I ask you to
Oh,
participate,
sorry.
then you can write in the chat, got it, okay. Okay. So Dr. Sumair, can you participate?
Yes, sir.
Okay, where is your answer?
Sir, in a donor screening, there's a third line, your temperature, your blood pressure, and the volume of fluids.
Yeah, that is good. Okay, but which viruses need to be checked before donating blood? So this is if you go there in text A, they're talking about treating blood loss, overall how to treat. Okay, it is possible to find the answer here also.
Yes, sir.
Okay, yeah.
Okay, sir.
So another thing is here is types of blood collection. You will not find the answer here. Here is just complication, their treatment, their signs and symptoms. Here is donor screening. In donor screening, it is possible to find the answer. Okay, according to
Yes,
the
sir.
heading. Then you will see in the detail.
Okay, sir.
Yeah. Next is okay. Number 5, process of blood transfusion for a patient with infrequent blood group type. Just write in the chat in which text is possible to find the answer. Quickly, please. In which text is possible to find the answer? So most of you are saying in text B. Let us go there. Okay, this is text B. This is your question. Just write in the chat you got the answer, please. In the chat, please. Okay. Where exactly you can find the answer, in which subheading?
Matched collection.
Matched collection. Okay.
In one,
Where the
process
donor
of
has
blood
been identified as a match of a specific patient with a rare or complex blood group. Okay. Infrequent. So here is synonym: infrequent, rare. Okay. Rare blood group. Infrequent. That is not frequent. It is rare. Okay. Blood group. So then process of blood transfusion for a patient with infrequent blood type. So this is here in this subheading: matched collection.
matched collection.
This matched donation can end up anywhere in the world. So it's a little bit rare. Okay. So now we will move to sometimes in the reading part A, you can get 5 or 7 questions. Please, this is not fair. Okay. Sometimes in the reading text A, you will get 5 questions in which text you can find the answer, sometimes 7. Okay. Just be prepared. Okay. No is fill in the blank. Fill in the blank. So, which type of reaction is usually seen in patients who have long-term anemia? In which text you can find the answer? Where it is possible to find the answer? Which type of reaction is usually seen in patient who have long-term anemia? In which text? C?
Yes.
Okay. Now you will just write in the chat your exact answer. This is not just text, it's fill in the blank, okay? You will fill in the blank and you will write in the chat, okay? What is your answer? Just in the chat, please, okay? Just quickly, please. Write in the chat. What are your keywords? What you're looking for in this table? What you're looking for? So once you see this question, how you will start searching in the table? How you will start searching in the table? Just talk with me, please. Anybody can unmute.
Type of
What are
reaction.
you? That is what you will see. There's written type of reaction, okay? Complication, type of reaction, okay? You not just this is you will find, but what is
Long-term
your keyword?
anemia,
And we can
chronically
patient
anemia.
civil patients. So I
Yes, please.
talking about the what types of patients. So here it's mentioned elderly, and after that long-term anemia mentioned
So
there's
your keyword is anemia, okay? Long-term anemia, anemia, okay? I'm going to remove this person. Is us. I'm really sorry. Okay. Okay. So what you will find? Keyword, okay? What is your keyword here?
anemia, long-term.
Anemia. Yeah. Long-term anemia, okay? So here is, so you will find here, you can see here, in sign and symptoms is a little bit difficult, okay? In treatment, no. Here in extra information you can find, and here it is written chronically anemic, okay? It means he is having long-term anemia. Chronic means that some disease that you have for a long time, okay? Long-term anemia, okay? So what is your answer? You have to write here type of reaction. So type of reactions you have TACO.
Transfusion-associated circulatory overloaded.
Okay. Do you think you should write this TACO or you should write the complete name? What is better?
Complete name.
Complete name?
Yeah.
Both are equal, okay? You
Yeah.
can write any of the
Yeah.
TACO or this complete, both are equal. And if you only write this, you will even save your time, okay? Because you don't have to write the complete text. You don't, no need to be worried about spelling and these things, okay? Just write TACO. They're in capital, but not write in small. Okay, next question is, which type of blood or blood product is not commonly transfused these days? In which text is possible to find the answer? In which text is it, you can find the answer? Just guess where it is possible.
It's a B because talking about different types of blood groups.
Which type of blood is not commonly transfused these days? In which text is possible?
B.
In B. Okay.
Yeah, B.
So most of you are saying B and A also. Let us try in B. This is text B. And here you can find please mute and try to find the answer. Can you find answer in text B or not? What you're looking for? What are your keywords? What are your keywords?
Blood or blood product and days.
You have to find some type of blood or type of blood product. Okay, this is what you will find, but your keyword is that is not commonly transfused these days. Okay, not commonly transfused is rare. Okay, is less frequent in transfusion, so you can find any of these matching words. Okay, similar words. Your text answer is not in text B. Where we should go now?
Text A.
Text A. Here is your text A and here is your question. Please try to find the answer.
The answer is in second paragraph.
Please just write in the chat. You got it. Okay. Okay, where you can find the answer?
So in the second para.
In the second paragraph, which line?
First line.
First line, very good, excellent. Okay, whole blood is rarely given to treat blood loss. Okay, which type of blood or blood product? Okay, it could be type of blood or blood product is not commonly transfused these days. Is rarely given. Okay, is not commonly transfused. So the answer is whole blood. Okay, you will this is fill in the blank, not only in which text you can find the answer. Okay. Next question. In the reading part A, most of the questions are easy. Some questions are a little bit difficult. This is your, this is the game of time management. If you can manage your time, you can find the answer quickly, you will get good marks. Okay, and if you get 19 out of 20, 20 out of 20 reading part A, then your chances of getting B grade are high. Okay. Okay, so next question is, what should be saved in case of blood transfusion to raise the issue with Canadian blood services? Okay. In which text is possible to find the answer? In which text you can find the answer? No, you cannot have an idea where you can find the answer. CRD, but out of CRD, where we should go? I think you have seen the word Canadian and these things in the D. In D, yeah, in D. No, this is fill in the blank. So where should I copy the question here? Okay, you can see your question, you can see the text, try to find the exact answer and write in the chat the exact answer, please. Give the exact answer. What is your answer? Let us see if there is other text. For me, I cannot find the answer here. I think so. Here you can see Canadian blood cirrhosis. Canadian blood cirrhosis. Try to find the answer here. Okay, what is the answer, Miss Nirmala?
Sir, I'm not sure. Still, I'm confused.
Still, you are unable to find the answer?
Yeah.
Okay,
I
try.
think quality assurance, but I'm not sure.
I think in the quality assurance.
Yeah,
The quality
but this is
assurance.
fill in the blank. You have to write one word there. One or two or three words there.
The answer is records.
Records.
Careful records.
Careful records or records. Okay. So blood center must keep careful records of every unit of donated blood. If a problem arises involving a donated unit of blood, the blood center must notify Canadian Blood Services and work with them to correct the problem. Okay. So what should be saved in case of blood transfusion to raise the issue with Canadian Blood Services? What should be saved to raise the issue? The record of every unit of donated blood. Okay, so you should save the records. Okay, but most of you were trying to find the answer here in this text because you found the word Canadian Blood Services here. This is what I want to teach here. Yes or not? And some of you were just trying to
Yes, sir.
some of you were just trying to find something here, even if it matches or not. You were not able to match your keywords here in this text, in this paragraph. So only thing is given here is Canadian Blood Services, but what you should save is not given. Blood transfusion to raise the issue. To raise the issue is not given. Blood transfusion is not given. Okay. These safeguards are implemented by Canadian Blood Services, the national organization that collects, distributes blood and blood products to all provinces. Okay. The process of blood donation and the handling of donated blood is regulated by TPD. Okay. The TPD enforces 5 layers of overlapping safeguards to protect the blood supply against disease. It's not written anywhere in this paragraph how to raise the issue, what we do to raise the issue, okay, what we should do to raise the issue with Canadian Blood Services, okay. Yes or not? If you don't find your keywords, but you find some of them, but you cannot find other keywords and you are not able to match your text by meaning, please don't try to enforce yourself to find the answer there, okay. Try, be open and try to find somewhere else. Your answer was here because here Canadian Blood Services is given also. Okay. This was a big practice. It would help you a lot, okay? What you have learned? Can anybody just recap what you have learned now from this question? Can you hear me?
Yes, sir.
I think it would be very difficult for me to continue the class if you keep people don't participate actively. But this is not just a video recording. This is just an interactive class. You have to participate. Okay. What you have learned from this question? What you have learned from this question?
We should not force ourselves to search answer in the same paragraph. Yeah, like if
Where you
there are
find, yeah,
something
where you find some keywords. If
yeah.
your other keywords are not matching, your meaning is not matching, please don't try to, you know, pick the answer from there. Try to find somewhere else. It could be anywhere else. If the examiner starts giving every easy question, all of you will get 20 out of 20, okay? How can I differentiate between you, who is prepared, who is not well prepared, or out of other students? Okay. And this is this is game of timing, okay? You will have only 15 minutes. If you waste your 1 to 2 minutes here, it means at the end you will not be able to answer 1 or 2 questions, okay? Okay. Which type or types of blood transfusion reaction is usually caused by staff? Now, in which text is possible to find the answer?
C.
In C?
Yeah.
Okay. Okay. Try to find the answer, exact answer, please. The voice is okay from my side. Please try. Okay. Which type or types of blood transfusion reaction is usually caused by staff? What you're looking for in that table?
Complication.
Okay.
The answer is hemolytic transfusion.
Please, I didn't answer. I didn't ask you answer. Just write in the chat, please. Let other people find the answers. Please. Write in the chat. Can you hear me?
Yes, sir.
Okay. So can anybody tell me what is the answer?
It's hemolytic transfusion reaction.
Number 2,
Yes,
why?
because in the extraneous, it says like it's often a clerical issues. What's reaction?
What do you mean by clerical issue? How we
That's
can say?
mean it's usually caused by the staff or work persons.
Yeah. I only see 2 or 3 answers in the chat. It means other people were not able to find the answer or they are not interested in finding the answer. So often it is a clerical issue. Okay, clerical issue means this is a mistake. This is a mistake by the staff. Okay, clerical issue. Just as I'm saying again and again. Okay, you will in reading part A, some of the questions would be very easy to find. You will be able to answer very quickly. Out of 20, 10 questions would be very easy. Almost 4 to 5 questions would be intermediate. You will spend a bit time, but you will find 4 or 5 questions would be a bit difficult. Okay, it's not like too difficult to find, but you will spend some time to find the answer. Like this question. I'm not exactly giving staff anywhere, the word staff. Can you just participate and talk with me? Have I given the word staff anywhere?
No, sir.
No, sir.
No, sir. Okay, very good. Okay. I even say type or types, which means it could be 1, could be 2 also. Blood transfusion reaction. Why I'm giving the word transfusion reaction? Why I'm giving the word blood transfusion reaction?
As a
Mm,
So
complication.
that,
help us
yeah,
to
yeah,
find
that is
answer.
okay. But I'm giving this because I have to give you clue. I'm saying these things because when I make any question or any examiner makes any question, if I only write uh, a mistake caused by staff, okay, then you will be wondering in text A, B, C, and D, you will not be able to find the answer quickly. Means you will be lost. Even in 10 minutes, you will not be able to find the answer. I am giving you clue, blood transfusion reaction. It means I'm asking some type of blood transfusion reaction so that you can jump into text C. Okay, yes or not?
Yes, sir.
Even all of you were able to jump to text C.
Yes, sir.
But
Yes,
when
sir.
you reach in text C, then I misguide you. I guide you for one thing, blood transfusion reaction. But at the same time, I misguide you by caused by staff. So I have used paraphrasing, I have used synonym, I have used similar language instead of clerical issue. If I say like this, which type of blood transfusion is caused by clerical issue? Do you think you will spend a lot of time to find the
No.
answer?
No, sir.
No. Do you think most of you will get this answer wrong or correct?
Correct.
Correct. Okay. So how I can differentiate between all of you? Like there are almost 25 students in the class now. How I can differentiate between you who is ready for the exam or not, and who knows synonyms, whose English is good or not, by using paraphrasing, by using synonyms, by using your similar language, okay, and by giving some questions where you will spend your time, where you will waste your time to find the answer. At the end, you will not be able to answer 20 questions in 15 minutes, okay? One last question we
Right,
will
sir.
do. One last question. Okay. Due to decrease risk of which autologous blood transfusion is considered to be safe? In which text you can find the answer? No, just think the clues I am giving you to which text you can jump, okay? Where you should jump, in which text? Just text me. You have my WhatsApp number. You can text me if anybody wants to join my individual classes for writing and speaking. So we have VAP hybrid course, and some of my students are here in the class also. They have already got B grade. Okay. So in speaking, I provide individual feedback of speaking. Okay. In which text you should find the answer?
D.
B or D? Some of you are saying D.
D.
B or D?
T.
Right in the chat, because
මතක තියෙනවා යන්නේ.
in the chat people are saying D. B.
ඒක තිබ්බ මට මතකයි තැනක කොහෙද කියලා ඉතින් මතක නෑනේ.
What is this? Okay. Let's try in B, because I think you have the word autologous is given there.
Yes, yes, B, 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 B.
Yeah. But most of you were saying in the chat. Most of you were saying in the chat D. Okay. So this is your question here at the end. Try to find the exact answer, please. Can you find the answer? Yes or no, please, just quickly.
Yes, sir. It's matched collection.
Match collection.
Yes.
Okay, very good. Can you match all of your keywords in the matched collection?
Yes, sir. In question, they said which one is to be a safe, and it's just like no, and the match collection should can be in the everywhere in the world. So it's just paraphrase.
For me, no. Decrease due to decreased risk of what? Is there any mention decreased risk of what, where the donor has been identified matched, rare or complex blood group, has been asked to donate specific blood to anonymous patient, the matched donation can end up anywhere. There's no mention of due to decreased risk of something. In autologous collection, there's no mention of these keywords before a scheduled transfusion. Person donates blood for their own use. This often when the person has a rare or hard to find blood type, or to create specific blood products for them. Do not push yourself to find the answer here. Your answer could be anywhere else. So where you can find the answer? Where else? In which text we should go?
D.
D or A?
A.
A.
There is a.
A. Okay.
Yeah, that mentioned in D.
Maybe A.
Okay. Just write in the chat. Don't tell me, please, because let other people find the answer also. Write in the chat. If you find the answer, write the exact answer in the chat. Write in the chat if you find the answer. Quickly, please try to find the answer quickly because you are spending a lot of time. Please try to find the answer. Whole blood people. Your answer is here in this. Just let me tell you, your answer is in this paragraph.
Yes, sir. In this paragraph.
Blood loss during surgery sometimes can be recovered, cleaned, and returned to you as a transfusion. Mean it is autologous blood transfusion. Okay.
Yes, sir.
Autologous. Because you know from here, autologous is a scheduled operational
Sir,
transfusion. A
answer is
person donates blood specifically for their own
blood reaction.
use. Okay, you know it is
Also,
autologous collection. Now try to find the answer, please. You can
sir, no
is
chance of
safe.
reaction.
So the no chance of reaction is already given. Decreased risk due to decreased risk. No chance is given already. You just
Sir,
need to put
own
a
blood.
reaction or reaction. Yet. What please? Own blood bag is wrong. Receiving your own blood back is safer. Receiving your own blood back means autologous blood transfusion. Receiving your own blood back, it means autologous blood transfusion. Is considered to be safe, is safer, okay? Is already given. Due
Surgery.
to decreased risk of, there is no chance means there is decreased risk. No chance means there is decreased risk of what? Your answer is just in this sentence.
Reaction.
Reaction,
sir.
very good. Reaction. You can say a reaction or reaction.
Safe or
People,
reaction?
a reaction, both are okay. People, believe me, reading part is not difficult, but some of the questions will be a little bit tricky. Okay? You will waste your time, you will spend your time. You have to match your keywords. Okay? And every question is not easy. Some of them are easy, but not all of them are easy. Okay? So if you get 19 or 20 out of 20 or 19 out of 20 reading part A, then your chances of getting B in reading are high. Okay. Otherwise, if you are 4 or 5 questions are wrong, then it becomes difficult to compensate because reading part B and C are already difficult one. Okay. If you have any question, you can ask me on WhatsApp. So tomorrow we will continue reading part A. We will complete other questions from this task. These are my own samples. You will not find anywhere else. So if I'm the examiner of this sample, I can teach you better because I know how I made this sample. Okay. So if you need any help for writing and speaking, you can contact me on my WhatsApp. And thank you so much. Please try to invite your friends who are taking OET exam so that we can increase number of students in our free class. Thank you so much, all of you.
Okay, bye, sir.
Thank you.
Thank you so much.
Thank
Thank
you,
you
sir.
so much.